I keep thinking about Deepak. What will happen? What will not happen? I keep seeing his face in front of my eyes.
मेरे मन में ठीक ही दौड़ रहा है दीपक भी हमारा दुनिया में जी सकता है.
When we talk about individual differences, these children took it to an entirely new level, making us ask questions about the complexity of the human body, unique genital mutilations, and physical appearance. From a baby born with extra limbs to a young girl without a nose, their rare conditions have fascinated experts for years. So, join us as we delve into the stories of these remarkable cases of live births that have left doctors and families in awe. Here are the 10 most bizarre babies born differently. Number 10. Deepak Paswan. Deepak Paswan was born in 2003 in a small village in Bihar, India, with a rare and astonishing condition that drew worldwide attention. Deepak entered the world with a parasitic twin attached to his abdomen, resulting in extra limbs protruding from his stomach. This condition, known medically as craniopagus parasiticus, is an extremely rare form of conjoined twinning, where a partially formed twin is attached to a more fully developed sibling. Deepak's parents, Ram and Indu Paswan, were devastated and overwhelmed by their son's unusual condition. In their rural village, where medical facilities were limited and superstitions ran high, many locals believed Deepak to be the reincarnation of a Hindu deity. This belief led to a mix of reverence and fear, with some villagers treating him with awe, while others ostracized him due to his appearance. The medical complications of Deepak's condition were significant. The extra limbs, although non-functional, posed serious health risks, including potential infections and physical limitations. Deepak's parasitic twin had not developed vital organs, but its presence on his body caused immense discomfort and difficulty in performing everyday activities. His condition required constant care to avoid infections and other health issues. Despite the challenges, Deepak's family sought medical help, and this led them to the attention of a team of doctors in Bangalore who were intrigued by Deepak's case and committed to helping him. In 2010, at the age of 7, Deepak underwent a complex and risky surgery at Fortis Hospital. The surgical team, led by Dr. Sharon Patel, meticulously planned and executed the procedure to remove the parasitic twin's limbs and other tissues attached to Deepak's abdomen. The surgery was a success, and Deepak's life changed dramatically. For the first time, he could move around freely without the burden of extra limbs. The medical team had to ensure that no vital organs or major blood vessels were damaged during the operation, making it a delicate and precise endeavor. Post-surgery, Deepak had to undergo extensive rehabilitation to adapt to his new body. Deepak Paswan is living well now, having successfully had his parasitic twin removed. Now he enjoys a normal, active childhood, free from the physical burden, and is excelling in school and sports, living a happy and healthy life. Number 9. Vanelope Hope Wilkins. Vanelope Hope Wilkins was born on November 22, 2017, in Leicester, England, under extraordinary circumstances that captured global attention. She was born with a rare congenital condition known as ectopia cordis, where her heart developed outside her chest cavity. This condition is extremely rare, occurring in about 5.5 to 7.9 per 1 million live births, and it often results in severe complications and a high mortality rate. Vanelope's parents, Naomi Findlay and Dean Wilkins, were informed of their daughter's condition during a routine ultrasound scan at 9 weeks of pregnancy. The diagnosis was devastating, and they were given little hope for her survival. Despite the grim prognosis, Naomi and Dean decided to continue with the pregnancy, determined to give their daughter a fighting chance. Vanelope's condition posed numerous medical challenges. Ectopia cordis is typically associated with other congenital anomalies, including defects in the heart and abdominal wall. In Vanelope's case, her heart was fully exposed and vulnerable, requiring immediate medical intervention upon birth to protect it and attempt to relocate it within her chest. A team of 50 medical professionals at Glenfield Hospital in Leicester, led by fetal cardiology expert Dr. Francis Bullock and pediatric cardiologist Dr. Olivier Guez meticulously planned Vanelope's delivery and subsequent surgeries. She was delivered via cesarean section to reduce stress on her heart and minimize potential damage during birth. Immediately after her birth, Vanelope was placed in a sterile plastic bag to prevent infection and retain body heat. Within an hour of her birth, she underwent her first surgery, where the medical team created an artificial chest cavity to house her heart. Over the next few weeks, Vanelope underwent 2 additional surgeries to gradually place her heart into her chest and cover it with her own skin. The post-surgery period was critical, as Vanelope needed intensive care to manage the risks of infection, heart complications, and the healing of her newly constructed chest cavity. The expert care she received allowed her to overcome these hurdles. Her medical team and parents closely monitored her progress, celebrating every small victory along the way. Vanelope's story is one of hope and a medical marvel. And today, Vanelope continues to grow and thrive, her journey inspiring many. Number 8. Kang Kang. Born in Hunan Province, China in 2009, Kang Kang had a rare and startling condition known as transverse facial cleft. This severe facial deformity created the illusion that he had 2 faces, with an extensive cleft running across his cheeks, splitting his face into distinct upper and lower parts. This rare condition, also known as Tessier cleft, is a severe form of craniofacial clefting that affects the facial structure significantly. His parents, Yi Fuchun and his wife, were devastated by their son's appearance at birth. In their rural village, where medical knowledge and resources were limited, they faced not only the emotional turmoil of their son's condition, but also societal stigma and misunderstanding. Despite the initial shock and the difficult journey ahead, Yi Fuchun and his wife showed immense resilience and determination to seek the best possible care for Kang Kang. A transverse facial cleft is an exceptionally rare congenital anomaly, often associated with other craniofacial abnormalities. Kang Kang's condition was particularly complex, involving not just the skin and soft tissues, but also the underlying bones and muscles. This posed significant challenges in terms of feeding, breathing, and speaking, all of which required meticulous medical attention and intervention. Kang Kang's condition attracted the attention of medical experts worldwide, and he became the subject of numerous studies aimed at understanding and treating such severe craniofacial anomalies. His parents, determined to give him a chance at a normal life, sought help from specialists in Beijing. At the age of 2, Kang Kang underwent his first major surgery at the People's Liberation Army's Military General Hospital, where a team of skilled surgeons, led by Dr. Li Zhong, embarked on a complex procedure to reconstruct his facial structure. The surgery aimed to realign Kang Kang's facial tissues and bones, closing the cleft and giving him a more typical appearance. It was a delicate and high-risk operation, requiring careful planning and precision. The initial surgery was successful, but Kang Kang needed multiple follow-up procedures to refine the reconstruction and address any complications that arose, such as infections or the need for further adjustments as he grew. Kang Kang's journey has raised awareness about transverse facial clefts and highlighted the importance of advanced medical interventions and support for children born with such rare conditions. Number 7. Shiloh Pepen. Shiloh Pepen, born on August 4, 1999 in Kennebunkport, Maine, was an extraordinary child who captured hearts around the world with her remarkable spirit. She was born with a rare congenital condition known as sirenomelia, or mermaid syndrome, where her legs were fused together, resembling a mermaid's tail. This condition occurs in about 1 in every 100,000 live births and is often associated with severe complications affecting multiple organs. Doctors gave her a very slim chance of survival, as sirenomelia is usually fatal within days of birth due to associated anomalies, particularly with the kidneys and bladder. However, Shiloh defied the odds from the very beginning. She was born with only a partial kidney and no bladder, yet she survived, astonishing her doctors and parents alike. From the outset, Shiloh faced numerous medical challenges. Her fused legs, while the most visible aspect of her condition, were just one of many issues. She underwent more than 150 surgeries throughout her life, including procedures to correct problems with her digestive system and to manage the complications of her single kidney, which eventually required a transplant. Her condition required constant medical care and frequent hospital visits. Despite these challenges, Shiloh's zest for life was evident to everyone who met her. She became a public figure after appearing on television programs like The Oprah Winfrey Show and Inside Edition, where she shared her story and spread awareness about sirenomelia. Her vibrant personality and indomitable spirit made her an inspirational figure, showing that a disability does not define a person's ability to lead a fulfilling and impactful life. Shiloh attended Kennebunkport Consolidated School, where she was a beloved student known for her positive attitude and determination. Her parents, Elmer and Leslie, were her greatest advocates and supporters, ensuring she received the best possible care and opportunities to enjoy life to the fullest. They adapted their home to meet her needs and supported her through countless medical treatments. Tragically, Shiloh Pepen passed away on October 23, 2009, at the age of 10, due to complications related to her condition. Number 6. Sierra and Sienna Bernal. These two ladies you are looking at are twins. Yes, twins. Their names are Sierra and Sienna Bernal, born on November 16, 2000 in Houston. While Sierra was born healthy, her sister Sienna was diagnosed with a rare condition known as primordial dwarfism, specifically Majewski osteodysplastic primordial dwarfism type 2. This condition results in significantly reduced growth rates, leading to a proportionately small stature throughout life. The twins' parents, Eric and Katina Bernal, discovered Sienna's condition during pregnancy. Ultrasound scans revealed that Sienna was much smaller than her sister, but it wasn't until after birth that the full extent of her condition was understood. At birth, Sienna weighed just 2 pounds, a stark contrast to Sierra's healthier weight. Primordial dwarfism is characterized by severe growth retardation, leading to numerous medical complications. For Sienna, these included skeletal abnormalities, cardiovascular issues, and an increased susceptibility to strokes. Her small size also posed challenges in daily life, requiring customized equipment and adaptations for mobility and everyday activities. Despite these challenges, Sienna's spirit have been remarkable. From a young age, she underwent multiple surgeries to address her skeletal and cardiovascular issues. Her medical journey required the Bernal family to seek out specialists and participate in research studies aimed at better understanding and treating MOPD2. Sienna's condition meant that she had to adapt to a world not built for someone her size. She faced difficulties with physical activities and needed special accommodations at school. Sienna attended school with her sister Sierra, participated in activities, and strived to live as normal a life as possible. Now in their 20s, Sierra and Sienna Bernal are living fulfilling lives. Despite Sienna's condition and their differing appearances, which often make it hard for people to believe they are twins, their bond and lifestyle continue to inspire many. Number 5. Manar Maged. Manar Maged was born on March 30, 2004, in a small village near Cairo, Egypt. Her birth was a remarkable and challenging event due to her rare and severe condition, known as craniopagus parasiticus. This condition involves a parasitic twin that is attached to the head, sharing a portion of the skull and brain tissue. In Manar's case, her parasitic twin had no functional body parts apart from the head, making her situation one of the rarest and most complicated medical anomalies ever recorded. Manar's parents, Hoda and Manar Maged, were initially unaware of the severity of their daughter's condition. The parasitic twin was identified shortly after birth, and it became clear that immediate medical intervention was necessary. The presence of the parasitic twin posed great health risks to Manar, including increased intracranial pressure, which could lead to brain damage or death if left untreated. The condition of craniopagus parasiticus is extremely rare, with only a few documented cases worldwide. The survival rate for infants born with this condition is very low, and the medical challenges are immense. For Manar, The key complication was the shared blood supply and brain tissue with her parasitic twin. This made any surgical intervention highly risky, as there was a significant danger of causing brain damage or fatal blood loss. In 2005, when Manar was just 10 months old, a team of dedicated surgeons at Bernal Children's Hospital in Cairo took on the formidable task of separating her from her parasitic twin. The surgical team, led by Dr. Ahmed Sobi, meticulously planned the complex procedure. The surgery lasted 13 hours and involved multiple specialists, including neurosurgeons, plastic surgeons, and anesthesiologists. The operation was a success, but it was not without its complications. Manar faced a long and challenging recovery process, requiring intensive care and several follow-up surgeries to reconstruct her skull and ensure her brain's proper functioning. Post-surgery, Manar exhibited remarkable resilience, but the road to recovery was fraught with medical challenges, including infections and the need for ongoing neurological and physical therapy. Manar's case attracted international attention and highlighted the incredible advancements in medical science, as well as the limitations and risks involved in such high-stakes surgeries. Despite the successful removal of the parasitic twin, Manar continued to face significant health challenges. Tragically, she passed away in March 2006, a year after the surgery, due to complications related to her condition. Number 4. Loi Singh. In a region where medical facilities are limited and superstitions abound, Loi's birth was met with a mixture of awe and reverence. Many local villagers believed her to be an incarnation of the Hindu goddess Durga, who is often depicted with multiple arms and faces. This belief led to a surge of visitors coming to their home, offering prayers and gifts, and seeing her as a divine being. Loi Singh was born on March 10, 2008, in the small village of Sienna, located in Uttar Pradesh, India. She was born with an extremely rare and intriguing congenital condition known as craniofacial duplication. This condition caused Loi to have 2 faces on a single head, resulting in 4 eyes, 2 noses, and 2 mouths. Diprosopis is a rare form of conjoined twinning that occurs when a single embryo starts to split into identical twins, but fails to complete the process, leading to partial duplication of facial features. Loi's condition presented significant medical challenges. Craniofacial duplication can lead to various complications, including difficulties with feeding, breathing, and vision. In Loi's case, managing these complications required careful and constant attention. She had 2 functioning mouths, but coordinating feeding was complex. Her 4 eyes also presented a challenge, as her vision was not entirely normal due to the unusual placement and potential fusion of optical structures. The local medical team, though limited in resources, did their best to support Loi. Pediatricians and specialists provided care, monitoring her health closely and addressing immediate concerns such as respiratory difficulties and nutritional needs. However, the rarity of her condition meant that comprehensive treatment options were scarce in a rural setting. Loi's parents faced the daunting task of caring for a child with such unique needs while balancing the influx of attention from both well-wishers and the curious public. Unfortunately, Loi Singh's life was brief. She passed away on May 10, 2008, just 2 months after her birth, due to complications related to her condition, including difficulties in breathing and feeding. Her death was a great loss to her family and the village, which had come to see her as a divine presence. All right, guys, it's time for our subscribers' pick. This picture you are looking at was shared by a brave Missouri mom who decided to show to the world poignant photos of her miscarried 14-week-old son. These images reveal the fragile yet remarkably developed baby, Miran, who bore a striking resemblance to his brother with a perfectly formed face. Sharon's decision to share these photos provides hope and insight to parents grappling with the difficult choice of whether to continue or terminate a pregnancy. She stated that her doctor had referred to the baby as medical waste and suggested a dilation and curettage (D&C) procedure. Refusing to let her son's tiny body be torn apart, Sharon chose to honor the sanctity of her womb through induced labor. Holding Moran's delicate form in her hands, she witnessed an extraordinary example of early human development, challenging common perceptions. Even though Moran never lived, Sharon's courageous act has since resonated with many expectant mothers, imparting a profound lesson on the sanctity of life and encouraging them to consider choosing life over abortion. What do you think about her choice to go through this procedure and birth this child? You can share your thoughts with us in the comment section. Number 3. Didier Montalvo. Didier Montalvo, born in 2006 in a small village in Colombia, is known for his remarkable and challenging medical condition that earned him the nickname Turtle Boy. Didier was born with a rare congenital melanocytic nevus, a condition characterized by an oversized mole or birthmark that can cover a significant portion of the body. In Didier's case, the nevus grew disproportionately large on his back, resembling a turtle shell. Didier's parents, Luz and Geraldo Montalvo, were initially overwhelmed by their son's condition. The large nevus not only caused physical discomfort, but also subjected Didier to social stigma and superstitions. In his village, some believed that his condition was a curse or punishment, leading to Didier and his family being ostracized and facing discrimination. The nevus was not merely a cosmetic issue. It posed serious health risks. The thick, wart-like texture of the growth limited Didier's mobility and caused significant discomfort. Moreover, such large nevi carry a risk of developing into malignant melanoma, a dangerous form of skin cancer. Didier's condition required urgent medical intervention to improve his quality of life and reduce his health risks. Despite the social and medical challenges, Didier's parents were determined to find help for their son. Their search for medical assistance led them to Dr. Neil Bulstrode, a specialist in pediatric plastic surgery based in London. Dr. Bulstrode and his team decided to undertake Didier's case, understanding the complexity and urgency of the surgery needed. In 2012, Didier and his family traveled to London for the life-changing surgery. The operation was highly complex, involving the careful removal of the nevus and extensive skin grafting to cover the affected area. The surgery took several hours, and the medical team had to ensure that the risk of infection was minimized while providing adequate coverage for Didier's back. The surgery was a success, marking a significant turning point in Didier's life. Post-surgery, Didier experienced a dramatic improvement in his physical comfort and mobility. The removal of the nevus also allowed him to attend school and participate in social activities without the burden of stigma and physical discomfort. Number 2. Hong Hong. Born on January 27, 2016, in Pingjiang County, Hunan Province, China, Hong Hong captured global attention due to his extraordinarily rare condition known as polydactyly. Polydactyly is a congenital anomaly that results in extra fingers or toes. However, Hong Hong's case was exceptionally unusual, as he was born with 13 one-digits, 15 fingers and 16 toes, making him one of the most extreme cases ever recorded. Hong Hong's parents, Yu Jinsheng and Feng Yanke, were shocked and overwhelmed when their son was born. Feng Yanke had experienced polydactyly herself, having 6 fingers on each hand, but the severity of Hong Hong's condition was unprecedented. The family faced significant challenges, both medically and financially, as they sought to provide the best care for their son. Polydactyly occurs due to genetic mutations that affect the development of limbs in the womb. For Hong Hong, the condition not only posed aesthetic and functional issues, but also required careful medical attention to ensure the proper development and functionality of his hands and feet. The story of Hong Hong quickly made headlines around the world, drawing attention to the rare condition and the family's plight. The international media coverage helped raise awareness and garner support from people who were moved by Hong Kong's situation. The family's goal was to seek surgical intervention to give Hong Hong a more typical number of digits and improve his quality of life. In search of a solution, Hong Hong's parents consulted several medical experts. The complexity of his condition meant that any surgery would be intricate and involve multiple stages. The first major step came when a team of surgeons at a hospital in Shenzhen agreed to undertake the challenging operation. The surgery aimed to reduce the number of digits, separate fused fingers, and reconstruct his hands and feet to improve their functionality. The surgery was a delicate process, requiring the expertise of experienced pediatric surgeons and specialists in reconstructive surgery. The initial operation was successful in reducing the number of fingers and toes, although multiple follow-up surgeries were planned to further refine and improve Hong Hong's hand and foot function. Number 1. Tessa Evans. Tessa Evans, born on February 25, 2012, in Magera, Northern Ireland, garnered worldwide attention due to her rare and striking condition known as congenital arrhythmia. This extremely rare congenital disorder is characterized by the complete absence of the nose and nasal passages. At birth, Tessa stunned doctors and her family with her unique appearance, but she quickly became known for her vibrant spirit and resilience. Arrhythmia is so rare that only about 100 cases have been documented worldwide. The condition posed significant medical challenges, as the absence of nasal passages affects not only appearance but also breathing, smell, and other vital functions. However, Tessa's parents were determined to provide her with the best possible care and a fulfilling life. Despite lacking a nose, Tessa could still breathe through her mouth. However, she required a tracheostomy, a surgical opening in her windpipe, to help her breathe more effectively, especially during sleep. Feeding also presented challenges, requiring careful management to ensure she received adequate nutrition. Early on, Tessa's family faced numerous medical consultations and decisions. They sought the expertise of specialists to understand the best course of action for her development and quality of life. One of the pioneering treatments involved creating a cosmetic nose for Tessa, which was a multi-stage process aimed at gradually reconstructing her facial features as she grew. In 2014, Tessa became one of the first children to undergo a revolutionary procedure at Great Ormond Street Hospital in London. The surgical team, led by craniofacial expert Dr. David Dunaway, implanted a small 3D printed mold under the skin where her nose would typically be. This innovative approach allowed Tessa's skin to stretch and create space for future implants that would gradually form a nasal shape. Tessa's journey was not only about medical advancements, but also about breaking social barriers and raising awareness. Her parents openly shared her story, highlighting her joyful personality and resilience. They advocated for greater understanding and acceptance of differences, demonstrating that beauty and worth are not defined by physical appearance. And that's all for today. Thanks for watching.